Well, good morning, good afternoon, and good evening. Welcome, everyone. I'm Lisa Moon, and I'm the president and CEO of the Global Food Banking Network. I'm pleased that you have joined us for another session of our virtual Food Bank Leadership Institute, which is a series of discussions we are convening throughout this year, both for our network and the broader food security community, to explore the very difficult challenges that we are facing in today's world. Today, we are honored to have with us Dr. Martine Burt to speak specifically about opportunities to advance poverty alleviation through food banking. Dr. Burt is a world-renowned social entrepreneur. He's developed various anti-poverty and educational social innovations that are currently being implemented in 5 continents. And he is the founder and CEO of Fundación Paraguaya, a social enterprise named Latin America's most impactful and innovative development organization in 2018 by the Inter-American Development Bank. He is currently a member of the board of directors of the Schwab Foundation for Social Entrepreneurship at the World Economic Forum. He is also a member of the board of directors for the Global Food Banking Network and Teach a Man to Fish. Dr. Burt has a very innovative and empowering approach to poverty alleviation that we at the Global Food Banking Network have found formative in our work and are very excited to learn more from him today about how he has seen this working on the ground. Before I turn it over to Dr. Burt, I want to cover a few housekeeping items. Please make sure you select your language preference using the interpretation button at the bottom of the screen. You can either select English or Spanish. And after we hear from our speaker, we will take questions from the audience. So I encourage you to submit your questions using the Q&A box at the bottom of your screen at any time. We will do our best to get through as many as possible. And finally, please note that this session will be recorded and is on the record. We're going to have a video recording of the session available on our website, as well as the slides that Dr. Burt is going to walk through today. So without further ado, I'd like to invite Martine to go ahead and start. I know you have a slide presentation, Martine, so we'll go ahead and have those shared, and then really excited for your remarks.
Hello, Lisa. Thank you very much for having me. Very happy to be with this incredible group of people. So let me share my screen, and then I can go over my slideshow presentation, my PowerPoint presentation, and hopefully spend most of the time today answering questions, because I'm really interested in working with food banks, not only in Latin America, but Africa, Asia, as well as the United States and Europe. And I think that we can find new ways of dealing with food banks now that we are facing a humanitarian crisis like we haven't faced before. I know that here in Paraguay, the situation is very bad. I cannot find another word. Homes are suffering, families are suffering. So let me share my screen with you and with the rest of the group, and see what we can move from there. Let me see. There you are. Okay.
Looks great, Martine. Thank you.
Okay, fantastic. So thank you again, Lisa. Thank you, Global Food Banking Network, and hello to everybody who is participating in this virtual leadership institute. Basically, what we're facing here is an incredible growth of the food banks around the world. We are now reaching almost 17 million people. There are almost 1,000 local food banks in our network. We are distributing 1.4 billion kilos of food and grocery products that are distributing. We have 191 volunteers who are engaged. 52% of the people we serve are children, and we are now in 44 countries. This is good news and bad news. The good news is that the food banks are responding to the challenge. The bad news is that we have so many families in need. So why do we have more and more beneficiaries? And the question here is the lack of food the problem? Or is it just a symptom and that the real disease, quote unquote, is something else. Here in Paraguay, we are working with a local Banco de Alimentos, a local food bank, and we are experimenting with interviewing and working with the families that come to the food bank. And we have found that, of course, poverty is multidimensional. We have some families that don't have water. We have other families that don't have proper sanitation and bathrooms. We have families that have health problems. So there are all sorts of issues affecting the families that are coming to our food banks. So we have developed a dashboard to allow families to self-diagnose when they come to the food banks, or when we take the food kits to their homes. We ask the families to do a very simple survey to find out how they're doing. And I would like to just go over the indicators. This survey takes about 20 minutes or 30 minutes. I'm just going to read to you the self survey that families answer. We have enough income. Our monthly income doesn't vary. We can access credit. We have savings. We have various incomes. We have IDs. We have running water. There is a health post nearby. We have good nutrition. We have good hygiene. We have healthy teeth and eyesight. We are vaccinated. We correctly dispose of waste. We live in a healthy environment. We have insurance. We have a safe home. We have a modern bathroom. We have constant electricity. We have a fridge and other appliances. We have separate bedrooms. We have a stove. We have plenty of furniture. We have good transportation. We have good roadways. We have telephones. We live in a safe environment, neighborhood. We have plenty of clothes. We know how to read and write. Our children go to school. We know how to earn money. We use a family budget. We have a group of friends. We have school supplies. We are informed of the news. We have time for leisure. We value our culture. We respect differences. We respect human rights. We belong to self-help groups. We know how to petition authorities. We can solve our own problems. We vote in elections. We have a family life map. We trust in ourselves. We consider others when making decisions. We control our emotions. We like our appearance. We don't have violence in our family. We are entrepreneurs, and we know how to make decisions. And this dashboard is done very easily in a tablet. So there are 3 images or 3 drawings per each indicator, and the head of the household looks at the 3 images and touches one of the images that corresponds to her. I say her because it's mostly the mother of the house. And she will press green if she is not poor in that indicator, yellow if she is poor, and red if she's very poor in that indicator. And it's a very simple technology that allows for heads of households to take a look at where they are and why they are there. This is an example of the stoplight visual survey that we use in Paraguay. In Paraguay, just having one faucet of water in the house means you're green and drinking water. If you have a well, you are yellow, and if you have to bring water from far away, you are red. Every country has different thresholds. And this would be a typical poor Paraguayan family who are not poor in everything. So this family could be yellow in income, red in family savings, green in nutritious food, yellow in bathroom. And what it allows is for this family to take a hold of their situations and make a family plan to overcome poverty. In this particular case, this family identified from all the reds and yellows in their dashboard. This family identified family savings, generating income, getting their IDs, having more sources of income, and getting vaccinated. And of course, the food bank or the organization will never have all the solutions, but there are organizations in every community in the world who can help, which is to say, there are people in Nigeria and in Brazil who need wheelchairs and can get wheelchairs. So it is a matter of having families become aware of their needs and having families set up their priorities and having families access resources that are available in the community, but that they may not know that. We are also incorporating young people in helping us with this. This is a case of our partner in Tanzania, where we are using students with whom we work in interviewing their own parents. So it serves as an educational tool and also as an awareness raising tool. The good thing about using a tablet is that you can geo-reference. In this particular case, it's a village in a rural area of Paraguay. And this is the first indicator. We have enough income. So in the same village, you will have non-poor, which is the greens, yellows, which are borderline, and red, who are ultra poor. This is the same village, but with indicator, we have a family budget. So basically, this is how it works. An organization, in this case, a food bank, joins a movement, and we adapt the indicator. We take away, we add indicators for the food bank in whatever country you want to take it. And once we develop indicators for a specific country, let's say an organization in Dominican Republic or in Uganda or in India wants to use the stoplight, we adapt the indicators to the local conditions so that it is very easy for family members to answer this. So the families administer the survey to themselves. They develop a life map and they execute the plan, which is on the left. And then the organization, in this case, the food bank, analyzes the results and comes up with local solutions that they may not deliver, but that there are in the community. And of course, nobody can do this alone. So we have developed an easy way of mentoring. We are working with non-governmental organizations and social entrepreneurs. We're working with private companies, with local governments, with communities, with schools. And it is an amazing thing that how easy it is because of technology to get families involved in understanding why they are going to the food banks. Using a dashboard goes against the grain because most governments and most development institutions use indexes. Indexes are used by decision makers at the top to aggregate data. For example, the multidimensional poverty index combines nutrition, child mortality, years of schooling, school attendance, cooking fuel, sanitation, water, electricity, floor, and assets, and they come up with one ranking and one number. The social progress index the same. We think that in many cases this is good, but in many cases it is better for families to have a dashboard at their disposal so that they can post the dashboard in their wall and understand that they're not poor in everything. They have many greens, they do have yellows, and they do have reds, but all the indicators are actionable. They can do something about it, and there is nothing that is beyond reach. This is how we aggregate the dashboards, and you can see it's in Spanish here, the indicators in a community. So the first bar at the top would be income. In this particular community, 35% are non-poor in income, 20% are yellow, that is, they're poor in income, and in this particular case, they're ultra poor in income. But you will see if you go after water in alimentación, that this family that is ultra poor in income may not be ultra poor in food. So every family and every community has their own set of blessings and challenges. We're also working with the United Nations to personalize the Sustainable Development Goals so people can understand them at the family level. So the indicator is not zero hunger. That's what governments work on. The indicator at the family level is we eat nutritious food. We sleep in separate bedrooms. We respect others or think of others when we make decisions. So it's personal, and people understand that quite well. And finally, this is our network from around the world. We have partners in Papua New Guinea, in Saudi Arabia, in South Africa. We're working in about 10 cities in the US now, in the UK. So let us know if you're interested in working on with a stoplight. We can do a pilot program with you, and it would be very interesting if we can use our food banks to help families understand why they are going to the food bank. Of course, the first response is, well, that's very easy. They don't have food. Maybe yes and maybe no. Maybe their lack of food is not because they don't have money. Maybe it's because of other things. And we have found that it is very important to activate families, to raise their awareness, and to have them become actors in coming up with the solutions. And the reason, of course, is for people to graduate potentially from our food banks so that we can reach other people. So I'm going to stop my presentation here and see if anybody has any questions. I would be glad to answer. Thank you, Lisa.
Martín, thank you so much for that. And really excited to have a conversation for the remainder of the session. You know, as you mentioned, just as an opening point, I think that for a long time, us working in the international community really viewed poverty through one lens, and that was through income. And maybe I could kick off the benefit of being the moderator and say, as you have, you know, interacted with families and discussed with them, how do they respond to the classification of poverty just as this one metric as income?
Well, they know that it doesn't, they know that low-income families have income problems, but it's not that they do not have access to income. In some cases, it is you cannot control your emotions. In other cases, there's no bus. In other cases, I need more training, and they benefit from seeing the big picture. Mm-hmm. So we're working with 400 organizations in 30 countries, and income, when exposed together with employment, health, education, housing, organization, and participation, becomes just one minor issue of things affecting the family. And so what we have seen is, if there are two types of surveys: an extractive survey where you extract the information from the families, and a participatory survey when the family is exposed to a tablet like this one, and they have to touch one image. And then they go to the next one, and this is, wow, they said, I better get my act together here. Why don't I have ID? Is I haven't got myself organized. Why don't I have teeth? Is it because there is no dental clinic in my village, or is it because I am afraid? In Paraguay, I do not know about other countries, most people that we deal with who have dental problems, it's because they are afraid of going to the doctor, to the dentist, not because there's no dental services. And of course, it is very easy for a family to develop a dashboard. They actually post this in the wall of their houses, and they said, I'm going to make my yellows and my reds green, if not in 1 year, in 2 years, but all the indicators are actionable and achievable.
Mm-hmm. Great. Well, we've got many questions from those participating. So the first one asks, aside from the food security and poverty questions, have you noticed any other more unexpected indicators that directly correlate with the need for emergency food assistance? Anything that you could say would be causal?
Interiority, self-esteem, capacity to control my emotions, capacity to work with the neighborhood as a group, social skills, emotional intelligence. These are real issues that affect the rich, the medium, and the poor. It affects all of us. So or depression, for example. The poor, unfortunately, in the world, are not allowed to have mental health issues. You and I can suffer from depression. We can go to a therapist and we can talk about our problems. But a street vendor, what is she going to say? I can't get out of bed right now. So this approach humanizes blessings. It allows people to be green in many things. Like, is this family poor? This family is encouraged to identify in what they're green, in what they're yellow, and what red. So there are, and of course, as Leo Tolstoy would say in his novel Anna Karenina, all happy families are alike, and each unhappy family is unhappy in their own way. We have to honor the uniqueness of each family, and we define family as those who eat and sleep under the same roof. And it works in Chicago, in New Orleans, in Newcastle, and in Cape Town.
Mm-hmm. Fantastic. We have a colleague joining us from the Yemeni Food Bank and asks, what is your strategy for improving the income of poor families?
Okay. Actually, income is one of the easiest. We have developed micro franchises that are turnkey businesses, so that whenever if a person is earning $300 and they should be earning $450 not to be poor, we have developed 10 or 15 businesses that they can do immediately. They can do cleaning supplies kits. We give them a kit of cleaning supplies. They take them home, they mix them with water, they bottle them, and they can sell door to door, and they can make $50 per kit. And of course, they can make a lot of money if they sell a lot. So if you don't like doing that, we also have a business of selling a motorcycle oil door to door. Or we have worked with an egg company where we buy wholesale eggs, and they get to sell it retail in the slums and in the villages where the companies don't reach. So we have a whole way of helping people double their income. And we have mentors, and we do training and everything. And of course, the training is 50% communication skills, getting along well with others, working as a group, and also learning how to calculate. The problem usually is not so only income, it is family budget.
Hmm.
I was working with a family last week, not far from the capital, and they said, my husband and I worked like crazies during the week, and in the weekend we buy Coca-Cola and we order delivery pizza. And when we started doing our family budget, we discovered that that's where all the money went. And so we stopped doing that and we built a new bedroom. So family budget is as important as generating more income. We know, of course, that many people just don't know where the money goes. And it's because nobody taught them how to develop a family budget.
Mm-hmm. Mm-hmm. Fascinating. Someone asks, can this methodology be started by evaluating NGOs? And what is the role, do you see, Martine, of the NGOs, for example, food banks, and facilitating a measurement like this?
Well, yes, we can definitely work with you in fact, we're doing this with a great team of people at the Paraguay Food Bank, heroes who have done humanitarian work in this country in the month of March, April, May. Wow. I've never seen so many dedicated people. So yes, we can work with using this methodology to evaluate organizational strengths and weaknesses and come up with a strategy for the food banks to I see if their governance is doing okay, if they're budgeting, if they're sourcing, all the issues that food banks have. It is interesting to have a dashboard so that people can see that you may be okay with transportation, but your warehouses have no security, or you have you may have refrigerators, but your energy supply is not constant. So all the food in the refrigerators gets lost. So a dashboard approach is something that we would love to work with any organization.
Do you have any data on how effective this method is in bringing families from red to green? Like how do you follow the families in this journey as they seek to improve their situations?
Yes, usually we start with a community. It could be, for example, the users of a food bank, right? Where I'm working here with a slum near the capital, where there is there are 17 food pantries in a slum, and we're going to be working with them in having a baseline so that everybody knows where we are. And then we're gonna implement the programs. In some cases, it's gonna be income generating. In some other cases, it's gonna be family violence. In other cases, it's going to be improving transportation. In other cases, it's going to be getting the latrine in order. And then you do another evaluation in a year, right? And we are doing we're working with about 8 PhD students. And we're also doing a randomized control trial with a control and comparison groups so that we can see, and we have seen with our difference in different statistical methods that when you compare families using the stoplight compared with families who do not use the stoplight, the families using the stoplight are more likely to overcome poverty than the ones without. Why? Because they're focused. They have a plan of action. They recover faith in themselves, which is the big problem of many families living in poverty. They are disoriented. And they don't know where to start. And of course, nobody would know how to start if you have 13 reds and 12 yellows, right? But if you show them a very easy process of establishing priorities, and the food banks, of course, only don't have the capacity to address these things, but they can establish a network with other solutions providers in the community. There are people who provide wheelchairs. There are people who provide dental care. There are people who deal with family violence in every community in the world, and mostly in. So the food bank basically empowers the families to go and search these solutions from the service providers. And the service providers, including governments, love this information How would the Ministry of Health find out who needs dental care in a village unless they come to them, right? So this facilitates the work of service providers very much.
It's a really good point. Someone else has asked, could you share with us where does the motivation to change the situation come from? So you're talking about obviously a household level change across many dimensions, not just about household income. Tell us, where does that motivation come from? How does this differ potentially than other poverty alleviation mechanisms?
Right. That's a very good question. We think that poverty is multidimensional. And also there are things that are structural, and that there are things that are behavioral, and that there are things that are cultural. So we were able to separate these things. We work with teachings of American famous psychologist called Albert Bandura. He's a retired Stanford University psychologist. And Albert Bandura says Skinner talked about rewards and punishments to change behavior. Bandura says people change when they think they will be able to change. He talks about agency and self-efficacy. So with this in mind, we think that for people to change, they have to answer yes to two questions. Is it worth it? And can I do it? Is it worth it has to do with motivation. And can I do it has to do with skills. So it's a combination of personal motivation, doing what is not fun, personal skills, overcoming my own limitations, but that is not enough. You also have to work with group support and peer pressure. But that is not enough. You also need to work with incentives and making physical changes in the environment. So we have a theory of change and a methodology that works, that we've tested it in Mexico and in India and in Argentina and in South Africa and in Tanzania. So basically, it depends on the indicator. You can be motivated to fix your teeth and not motivated to fix your eating habits. It depends on each family, and it depends on the indicator. Mm-hmm. And some indicators are easier than others for some families, and the opposite for the next door family. But technology is the key here. Technology allows families and the organizations that work with families to be able to administer this in a digital form and not in a paper file. The paper file, how are you going to manage 500 families? But in a tablet, you can very quickly, and with a digital map, you can very quickly administer this data. But most importantly, have the family be in control of their greens, yellows, and reds.
So Martin, how do you customize a program like this in a country like the United States or the United Kingdom? Because, for example, most households have running water, maybe not clean water though. So tell us a little bit about how you adapt the tool depending on where it's being applied globally.
It's very easy. In the United States, for example, we're working with a Salvation Army in Orange County in Southern California, working with the homeless. And we worked with social workers, working with the homeless, to identify what does it mean to be green, yellow, or red for a person in a homelessness situation. Some indicators are the same. Family savings, right? We save, we have family savings, and wherever there's an opportunity, an emergency, we can access savings, green. We do have savings, but sometimes yes or no, yellow. Red, we never have savings, and when there are opportunities or crises, we are bad. That indicator, by the way, works everywhere. But there are other indicators that are related to Los Angeles, right? In New Orleans, we're working with a great organization who works with formerly incarcerated Black youth in New Orleans to define what does it mean to be non-poor in New Orleans. And they know, every country knows what it is to be okay, what does it mean to be not good and really bad. So the adaptation process, we have a team of experts, and we can work with this Yemen organization. Most of the indicators are the same. I'm sure that there are unique aspects of each culture. And of course, the drawings and the language has to be easy, so that everybody, any person should be able to look at the three drawings, and they should be able to say, in this particular case, I am right. You touch it. It has to be intuitive. And we have been able to do it. In some cases, they use drawings in black and white, like in England. I don't understand why. In Paraguay, they use cartoons with multiple colors. In Armenia, they use photographs from the internet. But there is an Armenian and Turkish definition of what it means to be not poor in Yerevan, right? And people know, and so technology today, as I say, allows us to do the unthinkable. We started this thing with national or international plans. The United Nations Development Goals, these are international plans. And then you have national strategies. You have municipal, now we can have family strategies. This is a personalization, right? Every family in the world has a Facebook page. Well, why not every family in the world have a food bank page? Their own page of their needs to make sure that they have food security, that they eat nutritious food, that they address their issues, right?
Someone also has asked, if you're working directly with families, which many of your program providers are, what is the period of time normally that a family would be, let's say, engaged in the program, working with very intensive support to improve their reds to yellows or yellows to green? And do you ever consider them graduated, per se?
Oh, well, yes. It depends on the indicators. There are some families who pick it up really, really quickly. There are some families that are in denial, and they say, I'm never going to overcome this. But we work in groups. And so you work in groups, and incredible, Lisa, people share their information. When you and I do extractive surveys, that information is secret and sacred. But if you do your own stoplight, you can share it with whoever you want. And actually, people love to share their progress. And so we have competitions, who gets out of poverty first. We have a competition called My Kitchen, My Bathroom, My Pride. We have another competition, I look good and I feel good. That's to lose weight. Another competition is I have a beautiful smile. And people are encouraged to find someone in their family or in their neighborhood who has a terrible set of teeth, to take a selfie, and then they have 6 months to improve their teeth, and then they have to take another selfie, and they post it in Facebook, and whoever gets more likes wins. I don't know why, but people love it. Like these commercials on television in the United States, where people show their photograph. I used to be so many pounds, and now look at me. People love for other people to notice how they are progressing. That's why they show off their television, because other people will see, or their car or their motorcycle. And that's why many bathrooms are in terrible condition, because nobody notices that, right? So they have no need to show off or to be proud of that. In fact, that is a thing that we had in China, where we had many nice houses in the villages, but you go inside and you see some of the bathrooms and you say, wow, where did this come from? So yeah.
That's so fascinating. We have another question. Is once a family has completed their scorecard, how do they learn, or how are they exposed to good methods for improving in a specific area?
Right. for every country and for every organization, we develop a catalog of best practices and best strategies, right? What works? Let's say you're working in Mexico City. Okay, what works in Mexico City to generate income? Or what is the best place for families to save? Or what are the best ways to form a self-help group? There is a Mexican way of doing things, and you have to, of course, you have to work with Mexicans to do this. But food banks have the best of two worlds because they deal with the poorest of the poor, but many times in their suppliers, you have the richest, most powerful companies. And so they can facilitate things like that. So we have seen that companies supporting the food banks love this idea of promoting graduation. And if not in everything, at least in something. What you do not want is a family to feel I'm a basket case. I have no possibility of redemption. I'm never gonna, no, this is usually a disorientation and a depression. We need to get families to say, hey, and so this year, we started doing a lot of urban agriculture in Paraguay, developing vegetable garden kits for families to grow their own food. And it was just incredible. He says, well, I don't know why this thing never occurred to me. It never occurred to me. Now I have my tomatoes and I have my lettuce and I have my onions and my peppers. And so people, they like to be challenged. And we are working with indigenous tribes as well. We're working with families who have a very strong culture. And yes, approached well, they respond to nobody wants to go to the food bank if they can have food in their backyard or if they can have enough money. Right. So this is an opportunity for us who work with the food banks to really take advantage of our privileged situation that families allow us to touch them. Families allow us to shake their hands and to serve a dish. This is an act of trust. We have to respect that. And of course, many of them would love to sit down with a mentor or a social worker, what we call family extensionist, to say, Mrs., would you like to sit down just for 5 minutes and help, and they say, sure. And they who doesn't want to have their own dashboard to take home? We start usually with a tablet, but we give the families each one, we use stickers so that they themselves can put yellows, red or green stickers, and they like it very much.
So then what defines the finish line or the graduation from the program? Or is this kind of an area of, you're always evolving, right?
In some
level.
Yeah, it's always evolving. I mean, every country has their threshold, and many, in our case, poor families graduate into quote unquote more middle class needs. So you may be having problems with food, but once you solve that problem and you solve your bathroom problem and you solve your transportation problem, then you have another set of problems like college for the kids and transportation and bus fare. And like Chile, for example, is a great country that has done a lot of progress, Brazil as well, a lot of progress in many things, but now their society has new needs. So maybe this is the future, but we should be able to help families overcome their food insecurity issue. And I think that the interesting thing about the stoplight is that food insecurity is not only because of lack of food. There are other collateral issues out there that the family may not be taking into consideration. But once the spark happens in their brain, they say, I can do this, right? And you show them what we call positive deviance, people who should not have been able to solve their problem, but they did. People in their same village, in their same towns. So there are success stories everywhere in the world.
Yeah. We have a colleague with us who's from Texas, and she provides consulting services to food pantries to improve nutrition while reducing food waste. So they are experimenting by partnering with medical providers on integrating basic health issues into this, such as diabetes, heart disease, other diet-related chronic diseases, with foods provided to the families. So have you seen this anywhere else in terms of providing food assistance with those health considerations? And if so, what does that look like? What's the impact?
Yes, usually there is. Food banks here in Paraguay. The food bank is interested in making sure that the family understand what they're doing, what they're eating. They talk about nutrition. But what we have to overcome is fragmentation.
Mm-hmm.
There is so much fragmentation. For example, and I'll give you an example from outside the food banking thing. You have a child with worms, with parasites, going from the rural village to the health post. And in the health post, they will give them an anti-parasite medicine, and they will go back to their house and catch it again. Why? Because they go back to a unhygienic latrine.
Mm-hmm.
But the Ministry of Health does not do bathrooms. That is Ministry of Housing. And so the Ministry of Housing does not talk to the Ministry of Health, nor does it talk to the Ministry of Education. This stoplight is an integrated way to bring everything, all the problems and all the solutions to one unit of analysis, that is the family household. It is not the food bank. It is not the government agency. It is the family. So it really grounds everything, that the family is at the end of the day that has to achieve green in everything. And so, for example, the indicator is not I live in a food desert, as the Americans call it. The indicator is we eat nutritious food. You can live across the farmer's market and still eat frozen pizza with your children every night. So the key is, how do you personalize the outcome, the result of your work? We save. We eat nutritious food. Not there is a bank in the village. No, we save. And of course, there may be 10 banks in the village and nobody saves. So yeah, there are many food banks who work with collateral services. What I'm saying is, this looks complicated, is actually very easy, because everybody keeps on doing their own thing. Only that you just connect with other service providers who are so happy that you send them people over with specific needs. How would you like to, be the Ministry of Housing, and you tell them, listen, I have 138 families who have problems with latrines. The minister says, we can solve that. We have a kit for latrines. But they would never be able to penetrate and to know who in the village needs latrines or modern bathrooms.
Yeah, we've got a couple of follow-up questions related to that, Martine, in terms of, are there any places right now where the stoplight application is widespread that you're able to make those calls, let's say to a specific ministry or to a specific service provider, and say, we've got 138 families, 500 families that need this. Can we work together to go from red to yellow or yellow to green?
Oh, in many places, South Africa is a place, England is another place, Mexico is another place. In Ecuador, the government has contacted us. The government contacted us for a fair trade banana problem. Why? Because they pay an expensive fee to be considered fair trade when they export their banana to Germany. But they said, yeah, our bananas are fair trade, but our banana growers are still poor. Fair trade does not guarantee other than a better price. But if the family is not in charge of their finances, of their issue, that money, the extra money that they get, will not necessarily translate into the family well-being. So we started with banana. Now we're going to be doing cocoa. Now we're going to be doing coffee. We're talking to Nestle in Colombia and in Ecuador also to work with growers, coffee, young people don't want to be like their fathers, like their parents in the coffee plantation. So there's a problem there. So yeah, there are many places, and we can put you in touch. Depends on. I shared a map there in the last slide of where we are. We are looking for partners. We are looking for people who would like to help us develop this, change the indicators, adapt it. Yeah, it would be great. There's this Yemeni food bank that spoke earlier. We are developing indicators in Saudi Arabia, so some things are related or not. Every country is unique, you know.
Are there countries or regions, you say, where this is achieving enough scale to be transformative at the macro level? What spurs that, Martine? Is it getting a system actor involved, like a national government or like a major employer in a specific country or a community leader? How do you get kind of this household analysis,
it's
household
really
empowerment happening at a broad scale?
It's really difficult. It's really difficult. We're talking to the World Bank, and we ask them, why do you consider poverty lack of income? You know that it's more than that. And says, of course we know that. So why do you use it? Because we have no comparable data. That's what they answer. So international organizations have this need to have comparable data, and this lack of comparable data completely distorts the definition of poverty. It probably I can understand why. I mean, I understand why they did it in the 80s and the 90s. But today, every family has a Facebook page. So the technology is available there. We just have to be creative. We spoken with the Vatican. I spoke with the Pope. I told him, let's do a parish without poverty thing. There are many people in the parishes that want to do this. We're working with companies. The World Economic Forum, we're telling them, listen, if stakeholder capitalism, for it to work, involve the workers and their families. You cannot get workers out of poverty without their families. So we're struggling there. We still have a lot of way to go because people think this is too complicated. And actually, it looks complicated, but it isn't, because you enlist the protagonism of the head of the household. And the mother of a house is the best predictor of whether the family is going to be poor or not. You know, of whether her daughter will graduate from school, of whether their children will brush their teeth, of whether the mother is the leader, at least in our culture. So we need to ask the people, how are you feeling? You know, tell me, where does it hurt? And before, as I mentioned, it used to be impossible. Impossible. How are you going to go to a town and talk to everybody like that with 20 minutes each with a social worker in charge of 200 families? You can canvass a whole country. One social worker per 200 families.
Mm-hmm. You know, Martine, we're getting close to time, but I wanted just to, in closing, ask you, with the terrible economic and social destruction that the COVID-19 pandemic has caused, there is a lot of discussion about how governments should be responding. And there's a lot of discussion about social protection. And I wanted to pose this to you. You know, what's so powerful about this method is you are literally engaging the household, you know, and having them, you know, tell you what they need. So what would you say to national actors about how we can move forward post COVID-19 and empower people and families to change their futures as opposed to being prescriptive?
Well, exactly. Governments have social protection systems where they think that if all the institutions work, then it's a done deal. And it is not like that, because people are people. Families are families. And usually when they do not listen to the people, and of course, poverty persists, they blame the people. They say, oh, they're stupid. We opened up a training course and nobody showed up. Well, what type of training course did you open up? So I think that we have to promote participation and customization. Lisa, it has to be custom made for each family, and it is not a crazy utopia. I mean, it's difficult for people to governments like to deliver services. They do not know how to listen, and we are trying to show them it is easy to listen, and and food banks who deal with organizations at the slum level, they know how to listen. They're right there already. So I think that food banks are in a very privileged position to inform the governments. Listen, this is where people are aching. We're delivering food, but they don't have any glasses. Do you notice that in this line of people, nobody wears glasses? And it's not that in the village there's 20/20 vision. There are no glasses. So there are many reasons that are many causes of poverty that are invisible, even to the person, even to the affected person. Even to, I go to meetings in the villages all the time, and I have, of course, I'm used to it. When there's no one wearing glasses, I said, okay, we have a situation here that is, very, very grave. People don't read, and so they don't you have to do training in another way. But yeah, I want to thank you, Lisa, for this opportunity to work with you, to the great team at the Global Food Banking Network, to all the people who are participating in this virtual Leadership Institute. And you have my contact information. Please write to me. I would love to collaborate with you, learn from you, and maybe we have a Zoom call and we can advance, and hope that this crisis is an opportunity for us to change the way we were doing things. If we don't take advantage of this crisis, then we're really missing the boat. So yeah, I really congratulate you for this effort, Lisa.
Well, the congratulations goes to you, Martine. I really want to thank you so much for taking time to join us today and for this rich conversation. I would also like to thank all of you who joined us for your questions and contributions. I know there were a couple in the chat related to where the poverty stoplight is currently being implemented, and we will get to Dr. Burt on that and get back to you. In closing, I'd like to thank our Food Bank Leadership Institute sponsors, General Mills, HEB, Brambles, Cargill, the DLA Piper Foundation, Fundación Lala, and Ingredion. This session has been recorded and the slides are available on our website. Please do share it with anyone, and thank all of you who joined us today for your efforts to improve your communities. Have a great day.